Okay, good morning everyone. So this is your NCM 113A class. Okay, so the difference between your 113 and your 113A is that this is your RLE already. Okay, and we will be focusing on application of what you have learned in your 113. Okay, so there are three things that we will be discussing for today. First will be your expected curriculum. Okay, what is in the syllabus for 113A? What are the things that are expected of you in your 113A? Why is it that we are divided into subgroups for 113A? And if it is going to be a lecture rin lang, why is it that we are divided into 4 groups? Because there are some outputs. The goal is basically to virtually be able to let you guys feel what we do in community nursing, by applying the concepts that we have learned in our theory. Okay, so we are going to discuss the course outline for this morning, and then we are going to I'm going to show you photos or a slideshow of how the first batch, like my batch, how we were able to do community nursing. And also we are going to discuss the slides that that I shared to you yesterday, that I asked you to review. Of course, we are going to go back to the concepts of community health nursing and COPAR. Okay, so for your 113, course code here is wrong. Okay, so course title is Community Health Nursing 2, Population, Groups, and Community as a Clients, and this will be your RLE because it is the application already. 51 hours for the second half is targeted for this. I'm not sure if we will be able to reach that because I think 2 hours. I think 24 hours will be the target for this. Okay, so application of the knowledge, provision of safe, appropriate, holistic care for families and individuals for the nursing process. Okay, apply guidelines and principles of evidence-based practice in the fundamentals of nursing. Communicate effectively in speaking, writing, using culturally appropriate language, because of course you will be interacting already with what do you call this, with members of the community. Okay. Practice nursing in accordance with the existing laws and legal, ethical, moral principles. Report and record, which were some of the concepts in our midterms and finals, the importance of reporting and recording and monitoring. Number 9, function independently in collaboration with others. Okay, because remember in COPAR, it is not enough that you are able to implement programs. The goal is to be able to encourage participation of the community members to participate in the different activities that you will be facilitating in the community. Demonstrate leadership and competence, which is very important as you become leaders in the community, as you become health leaders in the community. Professional growth of self and others. Yes, because it is hands-on already and you are applying the principles to actual clients already. Ideally, kung nasa community sana tayo, okay, it will really lead to your self-growth, okay, because you are learning to take care of others already, individually and as a group. 12, practice appropriately the core values of Filipino nurses. It is only in the Philippines that community nursing is really practiced, okay? Because in terms of the Philippine setting, we've already discussed that there is practice of nursing inside the hospital and outside the hospital. Community nursing is anything outside the hospital. And of course, in our country, medyo third world pa tayo, kaya malaki ang practice of healthcare outside the hospital. Okay. But despite being a third world country, okay, the last topics in our finals in our 113 was e-health. Okay, so we have to apply techno-intelligent care systems in processing and managing resource and programs. So we also have to maximize whatever resources we have, let it be technology in the implementation of our community nursing. Number 14, perform nursing interventions that reflect caring behaviors in response to biophysical, cultural, and spiritual needs, and apply entrepreneurial skills in the delivery care of nursing. Okay, so in our theories class for prelims, we talked about different theories in healthcare, but we will see already what is the difference in 113A. Okay, so for our prelims, we will target the introduction, again, an overview of COPAR or community participation. So that was in the handout that I sent you yesterday, PowerPoint, and we will touch on that later. What are the goals of COPAR and principles of COPAR? Actually, ito yung target natin for today. Okay. There will be your phases of COPAR also, and we will see how we are going to initiate and implement COPAR in the different communities. Okay, so description, we start with the pre-entry phase. Okay, so pre-entry phase is before you enter the community. What are the things that you are supposed to do? Description, critical activities, initial consultation, selection for community for immersion. So it is the school that chooses where is the community that the students will go for immersion or kung saan kayo mag-duty talaga. For 18 years, according to our meeting yesterday, Kapangan has been one of the communities that we really dedicate ourselves to in terms of COPAR. Okay, and the masterals ni Ma'am Magwilang has been community nursing. Okay, so ako ang masters ko is on psychiatric nursing. Ma'am Magwilang, masterals and doctorate niya, she tried to, doctorate niya was on management of course already, but on masterals niya was on community nursing. So that is why the heart of community nursing is really different when it comes to your school, University of Cordilleras. Talagang masinsinan ang community, ang COPAR for UC. Okay, so talagang tinututukan niya ni Ma'am Magwilang. Social investigation, orientation, and planning of structured activities is part of your pre-entry phase. What are the goals? Integrate principles and concepts of physical, social, natural, and health sciences and humanities in population groups and communities. So the goals will be able to assess the health status of population groups, prioritize community health needs and concerns, and of course, develop a community diagnosis. Just like having your individual patients in the hospital, you must be able to diagnose your patients, your group of patients in the community. So when it comes to your community, of course, 3 levels of patients compared to your hospital. So in the hospital, you only have the individual, but in the community, you have your individual, family, and group of families, your community already. So you have to know your diagnosis first, get a diagnosis to know the interventions that we will be giving. Okay, so entry phase, the second phase is your entry phase or your immersion already. This is where you will be going to the community already. And I think this is the goal of your NCM 113A is to be able to, since hindi nga tayo makalabas, okay, so to bring the immersion to you through virtual. Okay, so paano namin kayo i-immerse sa community through the virtual? So I have things planned in mind. I know that despite it is lockdown, you still go out with your friends, you still go out with your family. So magagawa natin ng paraan that you will be able to practice community skills despite the lockdown, despite that we are not in an actual community as a group. But individually, we are still immersed in a family, in a group, in a community. So gagawa natin ng paraan na we will be able to do immersion activities online. Okay. So for the entry phase, there will also be a description, critical activities, description of activities. Ano ang ginagawa natin? The courtesy call, ocular survey at the barangay level, community integration, leadership spotting, initial core group formation. Basically, titignan mo kung sino yung mga active doon sa community, sino yung mga active na mga kagawad, sino yung mga active na barangay officials, and we are going to maximize their potential in implementing and leading activities in the barangay. Groundworking of identified leaders, tentative program planning, delivery of health services as come-ons, deepening social investigation. So aside from the things that you observe in the community, you will also ask the community members, ano po ba ang problema nyo dito sa community nyo? Start a series of community meetings, assemblies. Then yung mga consultation, you will be scheduling, like for example, 5 p.m. po, pag natapos lahat ng trabaho nyo sa community. Okay, is it possible that I can meet you? Like isang oras lang po sa barangay hall para mag-usap-usap po tayo at malinawan ako kung ano po yung mga kailangan nating isolve ng mga problems dito sa barangay nyo. Okay, that is your community consultation. ARAS, action, reaction, action setting is also one of the activities, and I will show you later in the pictures that I will be showing you kung ano itsura ng ARAS and structured activities. Okay, so midterms, organizational or bidding phase. Okay, so formation of organizations, sub-activities, training of people already. There's still ARAS. What else will be tackled in your midterms? Okay, because there are already projects that you are implementing in the community, you have to further consolidate, strengthen these programs, strengthen your relationships with the members of the community, and sustain the programs. Kasi hindi pwedeng sa intro lang. We don't only do COPAR the initial 2 weeks of your immersion. Of course, we have to make sure that the programs that you implement will be sustained and will continue until they reach the goals that you have set. Phase out and expansion. Okay, who are the people that have who have received the programs? How can we further extend the programs to other members of the sub-communities or people outside the community? Finals, of course, a lot of documentation already. Okay, but we will be talking about epidemiology, infectious diseases, sepsis, sterilization, types of disinfection. Okay. Ito yung mga vital statistics that we tackled already for our theory. Source of data, because we are going to add this as your documentation in your COPAR actual documentation already. Sources of data, rates and ratios, ilan yung nanganak, ilan yung mga nagkasakit during your time in the community. Crude and general rates and specific rates, death rates, etc. And presentation of your data. Okay, as you end your community rotation, as you end your rotation or your immersion, of course, you will have to show your data. What are the things that you have achieved in the community? Okay, so a copy of the syllabus will be sent in our group chat later. Stop this. And I will show you another screen share. Okay, so yeah, as part of our siguro icebreaker, okay, I will show you okay, this is a slideshow I use in my IMCI training. I know you are also doing your IMCI. But these are some slides or compilation of photos from the first batch of nursing graduates. Okay, and to show you that simulat sa poll, okay, we are already doing community nursing. Okay, so please don't mind this as an introduction to IMCI. I am using it now for your introduction for your 113. Okay, again, this is the College of Nursing batch 2006, the first batch of nursing graduates of the University of Cordillera. So yeah, that's me. Sino po ba ang mga pioneer batch na siguro kakilala nyo? Si Sir Ebes, si Mika, he is also first batch. Ma'am Hana is also first batch. Okay, so ang mga faculty namin noon, of course, si Ma'am Magwilang was not yet the dean before. She was one of the coordinators for community. So dati pa lang, community talaga yung talagang focus ni Ma'am Magwilang. Okay, and I will use this also as one of the target goals for today is your introduction for COPAR. Okay, so community health nursing is one of the two major fields of nursing in the Philippines. So nabanggit ko kanina. The other is hospital nursing. So hospital nursing and community nursing. Any practice of your medical nursing outside the hospital is already your community nursing. So we said in our lecture, let it be in school, let it be in barangay, let it be in the workplace, that is still considered community nursing. Community health nurses are those who work in the RHU or your rural health unit. Okay, barangay center, health centers, that is your community nurse. Sometimes also as students, we have our duties. Okay, instead of just going around barangays, so from house to house, okay, we also do duties in the barangay hall or in the barangay health clinic. Okay. These people who do nursing in the RHU are called PHN, public health nurses. Okay. Occupational health nurse, company nurses, and school nurses are classified as community health nurses as well. Okay. Community health nursing is the practice of nursing outside the hospital. Why? Why do some nurses choose to be community health nurses? Okay, the shifting. Sometimes when you say shifting, dalawa, it's either because they do not like the shifting in the hospital. Kasi if you work in a hospital, what could be the shift? You work from 7 to 3, 7 in the morning up to 3 in the afternoon, then not permanently. Sometimes naiikot ka, you get duty in 3-11, 3 p.m. up to 11 in the evening. Okay, kung 8-hour shift. And of course, the graveyard shift, isa rin sa pinaka-ayoko, lalo na pag hindi siya special ward, is your 11 to 7. So you have to be on duty from 11 p.m. okay, up to 7 in the morning. Okay, so yeah, puyatan talaga yan. And sometimes, some nurses, especially yung mga tumatanda na, they don't enjoy being in the graveyard shift or unpredictable. Like for example, this week morning shift ka, next week graveyard shift ka. So that changes in scheduling, that shifting sometimes hindi it doesn't it is not conducive to a normal lifestyle. Okay, so same as we laugh as the people who work in the call center. People who work in the call center, parang di ba pag umaga, yun ang gabi nila, that is the time they sleep, and night time is the time they work. So that type of timing is not really conducive for a lot of people. So for some nurses, they shift from, since I cannot just choose a specific time that I would like to work, especially gusto ko sana morning lang, they shift from the hospital, they go to community nursing, they work as barangay health nurses, for example. Okay. The shifting can also be like in BGH. Ang shifting ngayon sa BGH is 12 hours. Okay, I don't know if it's 7 to 7 or 6 to 6. Okay, tapos with the pandemic now, lagi nyo nakikita sa news na toxic talaga ang healthcare system in the hospital. Okay. Yeah, my father, as you all know, was confined in the hospital for a week because of COVID. And iba-iba. There was experience in the ER. Okay, so kung gaano ka-toxic yung mga nurses sa ER. Then when you reach the ward, the nurses are also toxic because ayaw nila mahawa. They wear PPE for 12 hours, 8 hours. So yeah, others prefer to work in a less stressful community, less stressful setting. So they go to the community. But it doesn't mean na the workload is not as essential, because being a community nurse, ikaw yung primary na pwedeng makasolve ng problem. You are the first line in solving the problem. Not because you are not in the hospital, hindi na important yung work mo as a community health nurse. It's up to you how you intensify the service that you give in the community. Okay? Also, why do people choose to be a community health nurse? Because of the pace. Okay, because yun nga, very fast-paced ang hospital nursing, especially pag nasa emergency room ka. Okay, so the level of patients can be very critical. Pag nasa hospital ka, life and death, almost lahat ng situation, lalo pag admission in the ER. Okay, and some people sometimes get tired of that. One of my the nurses that I look up to, Sir Vince Leones, for example, he was my instructor also before, and I still get in touch with him. Ano siya, trauma nurse, trauma care nurse siya sa Texas. When he left for the States, when he left the Philippines, yun ang naging nurse niya, ang work niya. He's a trauma care nurse. So a lot of accidents, ER nursing, yan ang naging work niya. I think for 10 years of doing that, nagsawa siya. He became numb. Na-realize niya na minsan kapag namamatay yung pasyente, wala na yung emotion sa kanya. Kumbaga, sanay na siya na namamatayan ng pasyente, sanay na siya na nakakita ng relatives na umiiyak, for example, because trauma care. So talagang mga critical care, mga na-aksidente, vehicular accidents, gunshots. Okay, so of course, hindi naman lahat ng patients nasisave, and he realized that he was becoming numb already. Plus the, what do you call this? Plus the, of course, minsan mas toxic gabi, for example. So lahat yun, after 10 years of working as a trauma care nurse, he decided to stop working in the hospital. So he shifted. Now, he still works at almost the same branch, emergency pa rin. Pero he now works as a coordinator. So for example, he coordinates if where care has to be given, where an ambulance, sino yung mga naka-duty for ambulance duty, sino yung mga staff, kumbaga nasa management na siya. Okay, ayaw niya na sa actual ER. Okay, so yan, because of the changing of the pace. Yan, that is the reason why some prefer to be community nurses. Okay? And once you experience becoming a community nurse, it is a breather from it all. So when we were students also, you will spend like 4 weeks in the community. Okay, so yung 4 weeks na yun is your break from, it can also serve as your break from the hospital, kasi how many weeks ka stressed in making paperwork, reports, rotating in the hospital, tapos when you go for community, yeah, medyo relaxing siya kasi nasa probinsya ka. Okay, and I hope you will see it later in the pictures. Okay, this is UC Community Health Nursing 101. This is around 2004. Okay, so yeah, I don't know if you can see it, pero yan ako. This is in Mangkayan, Benguet. Okay, and other pictures are in Sablan, Papa, and other parts of the community. So when you say Community Nursing 101, of course, this is the introduction. First time namin mag-community nursing dito. So if you see here, I don't know if it's clear in your laptops or phones, and nasa likod namin is a bus. Okay, so it took us, I think, in 2004, mga 3 hours pa yata It takes 3 to 5 hours, I don't remember, to get to Mangkayan. And we rode a bus going to Mangkayan. Doon kami nag-community nursing. This is my group mates, and yung pinakamatanda sa gitna is the barangay captain of the barangay that we were having our duties in. Okay? So the next picture here is your introduction already. So you have to visit the barangay captain in their barangay hall or in the municipio. I'm not sure if we were having pictures here with the mayor, the councilors of the area. Okay, so yan ang community nursing. Community nursing 101 is also getting yourself introduced to the place. So you have to go from house to house, lakad ka sa mga barangay, sa mga bahay, okay, to be able to be familiarized with the place. Also, you get to introduce yourself to the people in the community. Okay. Mode of transportation. So sometimes you ride the bus, sometimes most of the time you walk. Sometimes here, you have to ride on top of the jeep. Okay. During our time, ano ba? Of course, some communities, meron kasi minsan mga community na scheduled lang yung mga sasakyan sa kanila. Like for example, transportation from their place going to Baguio, there is only sometimes 2 trips, one in the morning, one in the evening. Okay? And since dayo lang kami dun sa community, we do not want to be bothersome. So abala pa kami kung makikipagsiksikan pa kami dun sa jeep nila that goes to Baguio just once a day. So sometimes magta-top load kami, doon kami sa taas ng jeep sasakay. Okay? Or when we go from house to house, minsan sasakay kami ng jeep. Okay? So kaya yan, nakatop load yung mga iba. And that is your community nursing 101. Iba pa yung mga codes nun eh. Okay? So that is those are some of the photos. Okay? If you go back, you can see wala pa kaming uniform nun. Okay, unlike today. So we started just wearing a shirt, a community nursing shirt lang, and our pin, yun ang gamit namin nun. Okay, so wala pang uniform gaya ng mga gamit mo yan. So see, it's just green pants and a white shirt, tapos OB bag. Sometimes you wear your IDs. Okay. What do you do in the community? Of course, when you reach there, a lot of cleaning. Linisan mo muna kung saan kayo titira. So it's either sometimes you stay in a boarding house, or sometimes you stay in a classroom. Doon kayo titira for 3 days, 4 times a week, 3 days, 4 weeks for rotations. So 3 days sa community, 3 days sa lecture. Balik ka sa classroom. So you can see here the first picture, nililinis outside the community center, or I don't know, barangay hall siguro kung saan kami tumira nun. So naglilinis kami doon. This is cleaning inside. What else you do in the community? Of course, bibisita ka dun sa barangay health clinic. Okay, so kung meron silang barangay clinic, meron silang barangay health center, of course, courtesy call, magpapakilala kayo dun sa mga nurses, mga staff, mga doctor, okay, and tell that we are from the University of Cordilleras. Of course, it will be pre-arranged. Alam nila na darating kayo. What else? As you go through the barangay, this is Community Nursing 101. So of course, ang alam palang gawin ng mga students nun is BP taking, vital signs, introducing yourself to the people of the community. A lot of walking around the community, visiting house to house. The last picture. Okay, so yeah, give me a second here. Okay, sorry about that. Okay, yung last picture dito, Okay, hindi yan nag-iinuman, hindi yan Red Horse. Okay, if you can zoom in, you can see that soft drinks. Okay, so this is already social integration. So makikipagkwentuhan ka kung may makita kayong sari-sari store. Okay, you will be able to talk to people, introduce yourself. Okay, so introduce that you are from the University of Cordilleras. We will be here for 4 weeks. Okay, if you have any health concerns, we will be in the barangay health center or in the barangay hall. Okay, so yan yung social integration. Okay, so talking to the people of the barangay. Okay, so other pictures, doing community work. So kung ang nakikita mong ginagawa ng mga community people doon is preparing firewood, mag-prepare ka din ng firewood, you help, you assist. So these are some of the experiences na hindi mo na-experience sa bahay mo that you may be able to experience in the community. A lot of BP taking as first-timers. Yun ang alam mong service na ibigay, vital signs taking, vital signs monitoring. That's what you do in the community. Also in the community, there's a lot of eating. Okay, so luto kayo ng luto, kain kayo ng kain. And that is doon lalabas kung sino yung mga magaling magluto sa group nyo, sino magaling magpalengke. Okay, so doon nyo lulutuin lahat yan. You won't be able to buy food na luto na tapos dadalhin sa community because ideally you stay there for 3 days straight every week. Okay? Sometimes there will be celebrations. Kung makatiming kayo ng fiesta, I don't know why they have a big pig here. Either binigay ng community, okay, magkakatay, magkakanya or something, or they were helping preparing. Okay, so yan, maraming kainan sa community. This picture is your ARAS. At the end of the day, your clinical instructors or you as a group will talk. Okay, so what were the accomplishments for the day? Ano yung plans for tomorrow? Okay, those are your ARAS, action, reaction, action, setting. Okay, so a lot of bonding ang mangyayari dyan sa community. And this is also visiting schools in the community or school nursing, okay, as part of your community. So programs sa school, hygiene, etc. Yung mga health teaching pwedeng gawin sa school. Community health nursing highlights the following important points. The goal of professional practice is the promotion and preservation of health of the population. So you are there to promote and preserve the health of the people. The nature of practice is comprehensive, general, continual, not episodic. Okay, so that is why it is continuous. Sabi ko kanina, we have been in Kapangan for 18 years. So kung ano man yung mga tinapos ng mga previous batches will be continued by the next batches. And by the next batches, kayo yun. Okay? The knowledge base comes from medical science, nursing, and public health. Okay? The actions that we will implement there are based on science. Okay? It is not based on what do you call this? Conspiracy theories about COVID-19, etc., etc. Okay? So kung ano yung facts, kung ano yung mga napag-aralan natin in classroom, those are the things that we are going to implement in the community. You have 3 levels of client. Of course, the individual, the family, and the group. And practitioners' recognition of the primacy of the population of the whole. Okay, so we see the community as a whole. We just do not focus na ito lang yung family na gusto kong alagaan kasi mabait sila, or ito lang yung family na receptive, doon lang tayo mag-focus. No, okay, we see the whole community as a whole. Community Nursing 102. Okay, so siguro this is ano ba? Third year, second sem na siguro itong mga to. Okay, when we were doing our Community Nursing 102. So you can see different activities already. The first picture is surveying, okay, being able to draw maps, being able to identify the distance of houses from one another, being able to identify what are the boundaries of the barangay. Okay, so you can see here, I think this is Rojan and Jay. They were trying to draw a spot map. They were trying to recognize ano ba yung boundaries, hanggang saan ba yung barangay, ilan ba yung bahay dun sa area na yon. Okay? A lot of community nursing is hiking. So you can see here a lot of walking. Dala-dala mo yung bag mo, dala-dala mo yung mga gamit nyo. Okay? Because the jeep cannot take you For example, kung malayo yung bahay nyo dun sa, yung titirhan nyo dun sa daanan, okay, no choice, you have to hike. Okay. Third picture here, another level of client. So hindi lang puro matatanda, kay pati bata is your clientele. Weighing of children. Okay, so ito hindi lang puro BP taking. You can already see that there is already eye assessment, okay, that is ongoing here. Dito, I don't know what project that they were implementing, pero I can see, I think urine, okay, urine testing of sugar, okay, ang ginagawa. So mas mataas na yung level of skills na ginagawa ng nursing 102, community nursing 102. Okay, community health nursing is anchored on nursing theories and important concepts of public health such as greatest good for the greatest number. Again, you do not only focus on what do you call this, specific people na gusto mong i-treat sa community. Okay, you also have to see what is the problem that affects most of the people, okay, because there will be a lot of problems in the community, but you would like to solve problems that affect more people in the community. Okay. Other theories, of course, you still practice ADPI. There will still be assessment, planning, implementation, evaluation of the community members. Priority of health promotion and disease prevention over curative. Okay, because it is the first level of healthcare. What we want to do is promote. Okay, promote and prevent diseases. Unlike when we are in the hospital already na curative. Okay, if we are in the community level, ang gusto natin mangyari is promote health, keep the people healthy so that they don't have to reach the hospital. Hindi na sila magkasakit. That is the priority in community health nursing. Tools for measuring and analyzing community health interventions are developed. Okay, there will be questionnaires, there will be surveys, okay, for you to see what is the problem, okay, to be able to measure what are the problems in the community and analyze the improvements in the community. Application of principles of management and organization in the delivery of health service in the community. Community 103, hindi ko sure kung third year or fourth year pa kami dito. You can see already that the groups are more organized. It is not only visiting house to house, but there are already programs that are being implemented in the barangay. So the first picture, nakikita nyo marami ng tao. Ibig sabihin, this is an organized event already. It can be because they are invited for a lecture or they are invited for a head-to-toe screening, for example. So you can see the second picture, maraming pumupunta dun sa organized event. So hindi lang DP taking ang nangyayari. Now you can see taking care of newborn. Okay, nililinisan yung umbilical cord ng newborn. Okay. Some of the programs that you can implement in the community is planting of organic medicines, herbal medicines. So gumagawa sila ng herbal garden dito. Okay, so it can be beside the barangay hall siguro, okay, or there was a plot of land given. Ang ginagawa ng mga nurses was they were planting mga bayabas, katakataka, okay, things that you can use in the community as herbal medicines. This is Sir Ruiz. Okay, so 2005 pa lang, instructor na siya sa UC. Okay, and in the picture, I don't know if you can see it properly, but this is immunization already. So ang hawak ni Ate Wenny dito is a immunization vial. Okay, tapos they are going to immunize the child in yellow. Community nursing is a lot of hiking. So you can see here. Okay, so bundok talaga ang inakyat ng mga classmates namin to get to one house to another. Okay, so very exciting ang community nursing. School nursing. Your clientele, the school nursing still falls under community nursing. Your clientele are the students. The determinants of your clients would be age, developmental stage, and common health problems and concerns. So when you talk about community nursing in the rural areas dito sa Benguet, okay, some of the problems you will encounter are hygiene. Kasi minsan pag malayo sa Sa mga bundok, of course, mahina ang tubig, so hygiene talaga. What else? Priority for the water supply is focused on drinking, cooking, and in watering, irrigating the farms. So hindi ganong ka-priority ang self-care. Okay? So yun yung mga concerns. Hygiene, head lice, worms, okay? Parasites, yan yung mga concerns minsan. Considerations, genetic considerations, environmental, economic concerns. Of course, minsan sa mga Benguet areas na may hirap, okay, so meron silang food kasi meron silang farms. But in terms of money to buy medicine, money to buy healthcare, dyan medyo hirap sila. The aim is to promote the health of school children. Why do you want to promote the health of school children? Because they are in school to learn, to develop. Okay? So pag healthy sila, mas matututo sila, mas makaka-attend sila ng school. So the aim is to promote health of school children to avoid illnesses that would hinder their learning and development. Okay? So 104, school nursing. Okay, so ganun rin. A lot of hiking, a lot of climbing. Hiking from where you live, barangay center to the school, barangay center to the different houses. So as you walk, going to your destination, may mga makakasalubong ka mga community people. Okay, so of course, you will give them healthcare services already. The third picture is house visits. Okay, so you will visit, you will be assigned, for example, 2 persons at a time per house. Okay, so you will interview people in the house, introduce yourself, let them know why you are there. Okay. School nursing, of course. So you can see here, this is a blackboard, welcome visitors. Okay, so most likely this group of students were assigned to this school and you are going to facilitate health programs in the school. So for example, it can be about health teaching about hygiene. It can be gathering data. So you can see here, the nurses are measuring the height, weight of the children, assessing for dental cavities, checking their ears. Yan ang mga pwede nyo gawin sa community school nursing. Teaching them about kung mga high school students, secondary, senior high students, you can teach them about sex education, reproduction. Okay? So yung mga pwedeng ituro sana kung may community nursing tayo ngayon. Other important concepts of community health nursing. Community health nursing is composed of 3 major concepts. Your community as the client, your health goals, what are the things that you would like to achieve in the community, and how will you achieve those goals? Of course, through your nursing means. Okay. A universal declaration of human rights. Everyone has the right to standard of living adequate for health, well-being himself, his family, including food, housing, clothing, medical care, services. Okay. Despite unemployment, sickness, disability, age, lack of livelihood circumstances. Okay, that is from the World Health Organization. Okay, community nursing 105. Most likely this is the termination phase already. Okay, kaya na-implement na lahat ng mga goals nila. 105 or 106 is most likely 4th year, 2nd sem. So what will you see here? Yung mga staff nakikipag-picture na. Okay, yung mga students nakikipag-picture na sa mga staff. Okay, I think they are trying to say goodbye already, remembrance. Here, termination na, nagpapaalam na sa mga doctors, sa mga teachers, sa mga faculty, okay, sa mga midwives. Documentation is very important. So way back 2006, you don't see them bringing laptops. Okay, everything is handwritten. Everything will be pag-uwi sa bahay, tsaka ka magko-computer. Okay, so what are the data collected? What are the programs that were implemented? All documented. I don't know if this was something that was donated to the farmers. So siguro nakita nila one of the things that they need in the community is a fertilizer spray. So I think ito dinonate nila. Also here you can see that art supplies or school supplies are being given by the students to the people. So mga remembrance, siguro mga gamit ng para sa bata. Students. Here, termination phase. So when you go house to house, papaalam ka, ma'am, tapos na po yung rotation namin. And here are some instructions that you would like to we would like you to continue, okay, despite the tapos na kami. Okay, so mga follow-up instructions on their checkups, their medications, yan yung mga ginagawa siguro dito. Final instructions before the termination or before they pull out from the community. Public health is the science and art of preventing disease, prolonging life, promoting health through organized community effort. For sanitation, okay, communicable infections of individual hygiene. Primary healthcare, essential healthcare based on practical, scientifically sound, and socially acceptable methods and technology made universally acceptable to individuals, family, and community for their participation. Okay, so that is, yan, mga ginagawa namin sa community nun. Okay, and sana magawa nyo rin, but I don't know how. Okay. I will end the screen share and go back to yesterday. I shared to you a slide on COPAR. This is, I think, 20 plus slides, and you will go through them as part of your syllabus nga. We have to finish this introduction of COPAR before we go to the actual activities. Okay, so when you say COPAR, Community Organizing Participatory Action Research, you have to research on ways, on activities that the community needs and find ways how to encourage their participation, because we are not just there to implement, we would like them to participate in their health. Okay, so health situation. We assess the health situation. Leading cause of illness and deaths are preventable and most curable. Leading causes of illness are mostly communicable, while leading causes of death are mostly lifestyle-related diseases. Okay, so their diet in the community, their livelihood. If it's a mining community, of course, there will be accidents, and that could be the cause of their health problems. Health services are inadequate, unaffordable, inaccessible to majority of Filipino people, especially in far-flung areas. Okay, so that is very true. Money becomes a restriction sometimes on how we are going to receive health care. Health resources, manpower, facilities to address poor health situation. So if in the cities like Baguio, nagkukulang tayo ng doctors now during the pandemic, what more in poor areas, okay, in terms of facilities, in terms of manpower? That is the problem in the communities sometimes. What is presented in front of you, okay, are the major causes of morbidity, okay, in 2019 and 2020. Okay, so ischemic heart disease, cancer, neoplasm, CVA, cerebrovascular accident, DM, pneumonia, hypertensive diseases, around hypertensive diseases, you can tie that to your cerebrovascular and ischemic heart diseases, chronic lower respiratory infections, heart diseases, tuberculosis, diseases of the liver, viruses, transportation accidents, yan yung mga other assault and other causes of death. Okay, so yan yung mga data that you will be able to spot or collect when you go to your community. Root causes of the poor health situations in our community. Okay, social related inequality. Okay, social, of course, yeah, hindi naman talaga pantay-pantay. Okay, because of social concerns, political concerns as well. Sometimes those who are closer to those who are politically in power, okay, they have more access to healthcare. Economic, okay, the more money you have, okay, the more access you have to healthcare. Kung wala kang If you have money not to go to public hospitals, you can go to private hospitals. If you don't have time to wait or to line up in public hospitals and you have money, okay, you can do that in private practices. You can go to clinics that you can pay. Cultural, sometimes cultural restrictions are the reasons why people don't go to health facilities, okay, kasi bawal sa religion namin or we don't believe in that. Okay? So magpakanyaw na lang tayo tapos gagaling na yan, for example. Depende. Agpadara tayo, for example. Ecological, I don't know what ecological they mean here, but if in terms of geographics, sometimes some areas are hard to reach, kaya hindi sila makapunta sa mga health facilities, or the health facilities or barangay people find it hard to reach their places as well. Okay? So those are the reasons why there are problems in terms of delivering healthcare services in the community. It's social, divisiveness of people. So hiwa-hiwalay sila in terms of belief, in terms of social groups, individualistic and voiceless poor. Sometimes if they are poor, in terms of their opinions, in terms of their needs, hindi na naririnig. Lack of people's participation in matters affecting their health, because sometimes they are more focused on providing for their families. They are more focused on getting money para makakain sila for the day. Okay, that health sometimes goes to a least priority for them. Fragmented approach to healthcare, because healthcare for them is not clear. Okay, hindi important sa kanila ang perspective of health. It is more important to eat now, to see that my kids are eating, to be able to go to work, to be able to provide. Yun yung madalas naging priority, but taking care of their health doesn't become a priority already. Political, kay rampant graft and corruption is a reason kaya hindi natutuloy yung health center, or hindi na ibibigay yung gamot, or hindi na ibibigay yung ayuda. Okay? Misprioritization of the budget. Okay? For our government, a lot of money goes to the education, DPWH, Interior and Local Government, DOH. Okay, so hindi ganong kalaki yung pondo ng DOH. Mas malaki na pupunta sa military, for example, DILG. Okay, so misprioritization. Thus, pag umaabot sa mga health center natin, hindi rin maximized yung money na nare-receive nila, or mga grants na nare-receive nila. Economic poverty. Okay, so most of the money will go on what? We'd rather buy food, we'd rather buy a new car than invest on a health insurance. Okay, so what else? Bili na lang tayo ng things that will make our home more comfortable instead of focusing on investing on health. Okay, low investments for health. Cultural, lack of health and manpower. A lot of community health facilities do not have manpower. It was explained by Sir one of our faculty na dun sa area nila there hasn't been a doctor. Ang pinaka-doctor nila dun is a midwife. Okay, si Sir Ken in one of the barangays in Kapangan. In-explain niya na it's been a long time na nagkaroon sila ng doctor dun sa community health center nila. Swerte na sila pag may nurse. Swerte na sila pag mayroong mga student nurses like you. Okay, but most of the time, the only personnel in their community health center is just a midwife. Okay? Kasi of course, yung mga doctors, they are more focused on being in the hospital. Okay? Mas malaki rin ang pera sa hospital compared to community nursing, community health services for them. Literacy or miseducation. If you are not educated, okay, how will you prioritize health as well, or your body? Unscientific beliefs or practices. Okay? Yung mga hilot, yung mga faith healer, okay, sometimes they will become sila ang tinatakbuhan and hindi yung barangay health center. Curative focus of health instead of preventive. So we talked about this earlier. So pag may sakit ka, you just go to the hospital, parang yun ang belief. But instead of focusing on preventing through diet, through healthy living, okay, so hindi nabibigyan ng priority. Ecological, poor environmental situation, pollution, destruction and exploitation of life support systems. So there will be sometimes poisoning, mercury poisoning, because ang goal is to be able to mine. Okay, so sa mga communities like na malapit sa mga gold mine sites, okay, so yan, there will be poisoning of the water supply because of mercury use. There will be landslides because of their mining. Okay, kasi mas focus nila na kumita ng pera. So what are the responses to different health situations in your community? Okay, so they go to clinic or hospital-based approach. Pag may sakit ako, pag malala na, pag hindi ko na magamot sa bahay ng paracetamol, I go to clinic or hospital-based approach. Primary healthcare approach sana is in the community, okay, which focuses on prevention. The People's Health Assembly of 2006 analysis of primary healthcare approach utilization remains selective primary healthcare instead of a comprehensive primary healthcare approach. So instead of focusing on preventive as much as curative, most approach goes on curative or the clinical or hospital-based approach already. Effects of the response to the health situation. What happens? Minimal changes on the health incidences. They are still under development in the health. So meron pa rin mga problema in our community settings. Kaya kailangan pa rin nating ipagpatuloy ang community health nursing. Okay? There is underdevelopment despite identifying that there should be prevention before cure. Okay? There is still underdevelopment, both for the clients and for the healthcare system. Okay. What is an alternative approach to the underdevelopment of our healthcare system? Okay, COPAR. Okay. Because underdeveloped ang healthcare system natin, let's just modify it by giving community health services. Okay, the first part of COPAR is your first two letters, community organizing. A social development approach that aims to transform the apathetic, individualistic, and voiceless poor into dynamic, participatory, and politically responsive community. So what is the goal again? Gusto mong gisingin yung mga tao. Let them be aware that they are responsible for their health. A continuous and sustained process of educating. Okay, so two keywords here, continuous. Okay, from sabi ko nga, in Kapangan, we have already been there for 18 years. Sustained process, tuloy-tuloy in educating people to understand and develop critical awareness of their existing situation, developing their capacity and readiness to collectively act and harness their resources in responding to their own identified needs and problems. The community organizing, continuous process of empowering the people. We need to empower the people. We need them to know. We need them to appreciate their health. Empowerment or building the capacity of people for future community action. A nursing intervention process and a community-based health promotive approach. Okay, COPAR now is a process where the community organizes itself. Okay, we have to organize us as leaders, as external leaders, okay, to identify and analyze its own specific problems, plan and implement appropriate actions to solve and address the health and health-related problems. Participatory action research, okay, PAR. So it's not just community cooperation, but they have to be part of the research also. COPAR or PAR is a strategy for development wherein community needs, conditions, and problems are identified. Solutions are planned. Okay. Priorities are implemented through a partnership with community and other development worker, community leaders, and or the members of the community. Okay, participatory action research. Identify the need to conduct a research. Okay, you have to let the people identify that there is a need to do a research and study what are the problems in our community. Discuss and approve the research problems and objective. Okay. What are the problems that we have identified? What are the goals that we would like to identify for your community? Utilize very simple methods of data collection in conducting a research. So there are different ways of collecting data in the community. It can be by observation. Just go around the community and see what are the problems. It can be by interview, house to house. Ask them, kumustahin mo yung health condition nila, what are the problems. It can be by survey form. Okay. Collect and collate and analyze the data that you have gathered. And once you have collected the data, you prioritize what are the things that you would like to target first and solve first in the community. Formulate their own health development plan from the result of the data analysis. So start off solving the problems by planning, by collating the data. COPAR is a social development approach and a systematic continuing process of people transforming themselves from their culture of silence to a collective voice and action through what are the things that we'd like to do? Okay. We want them to undergo continuous education and collecting conscientization and awareness about their existing situation. So sometimes we need people outside of the room, outside of the box, outside of our families to tell us ano ba yung mga nakikita kong problems sa house nyo. Ano ba yung nakikita namin problema in your community. So it takes people or eyes from outside the family or outside the community, that is us, to let them know na may problema po kayo and there are ways to solve those problems, specifically about health. Okay? So that is us entering the communities and helping them identify and solve their health problems. Identifying their own needs and formulating their own objectives. If they cannot formulate their own, we will assist them. Okay? Paano ba natin masosolve yan? Okay? Developing their own capability, readiness, and political will to respond to their own needs. Okay? So letting them recognize that may pondo po kayo from the barangay, or you have equipment in the health center, or your kagawads can be trained to help you. Okay? So we give them options. Mobilizing their constituents. You yourselves can help each other to collectively act in such needs. Okay? Pwede po kayong tulungan ni barangay captain, okay, para may training kayo, may funding kayo, etc. Okay? Identify that the solutions are also within the barangay. A practical approach and process of enabling the people to increase control over their health. Okay, there's a quote here by Lao Tse: go in search of people, love them, learn from them, begin with what they have. Okay, because gusto mo i-maximize kung ano meron sila eh. Learn from what they know. Okay, so because they are the people in the community, alam nila kung ano yung mga resources na meron sila. But of the best leaders, when their task is accomplished, the people all remark, we have done it ourselves. So that is what we want to do. We want them to be able to identify and solve problems through our facilitation. Assumption of principles of COPAR. Okay, let's go to the principles. Do not ignore a highly pressing issue. Mass-based learning is imperative. I think we discussed this already in our theories. Provide people with opportunity to change and trust on their capacity to change. Provide true-to-life activities because it is easier to learn through experimental learning. Experiential dapat to, experiential learning. Okay, so this is what we want to happen in our 113A. I want you to experience COPAR kahit nandyan lang kayo sa bahay nyo. Let the people decide or allow for consensus building. People who want development to happen should strive for it. Okay, we have to make them realize that if they want change, they have to work for it. And always conduct action, reflection, actions. And so you have to really think about what you did for the day and ponder upon it. And then again, plan again. Anong gagawin natin bukas? What will be our goals of COPAR in health, people empowerment, social restructuring, alliance building, popular democracy. Okay? When you talk about popular democracy, hindi lang yung gusto ng leader, hindi lang gusto ng mga influential. Okay? It has to be a consensus of the majority of the population of the community. Ito yung gusto namin mangyari. Ito yung gusto naming decision. Okay? Hindi lang dapat yung decision ng isa or yung mga influential in the community. And of course, improve quality of health. What is the heart of COPAR? Local community organizers or function people organizing or communities capable of frontlining community activities. Okay, these are you and the leaders of the community. Agency community health nurse organization. A proper attitude. You have to be humble. You have to recognize that despite you being a VIP in the community, kasi guest ka eh. Every time you go to in your community, VIP ka. Okay, understand that you are a guest, okay, but you have to be also, you are a VIP, but you are a guest. Okay, so you have to be able to humble yourself also. Okay, you have to be knowledgeable and skillful. Okay, so that's it for the slide. Okay, for our first day of lecture of COPAR, okay, so we were able to target our, actually for the second day, okay, ito muna yung i-achieve natin na goals for today. Tomorrow, we are going to focus on the pre-entry phase, okay, and probably touch already on the immersion. Kasi yung pre-entry phase natin is just an introduction of how we choose the community. Okay, but we will probably start tomorrow on the also on the immersion phase. Okay, so this is how we are going to go through our 113. So broken into groups. This will be probably your group already until you turn until your fourth year. Ano pa? We will be trying to implement activities in your homes. Like for example, yung isang shinare sa chat group natin. I don't have it prepared right now. But one of the things that was shared in dun sa 113A chat group natin was the household survey form. So for you to be able to experience COPAR in your home, is I might ask you to complete the household survey form by interviewing people in your household, the head of the household. You may also be required to interview your neighbors, for example. Okay, so that is the one way of experiencing community with the present lockdown that we have. Okay, so yung mga activities na gagawin natin. Okay, so yeah, so tomorrow we will be on the pre-entry phase and probably the entry phase. We will be having a discussion on that as well. But for now, we were able to finish the introduction of our 113A, an introduction of your COPAR, the goals of COPAR, and principles of COPAR. Okay? And yeah, if we don't have any questions, that's it muna for Tuesday, for today. And then I will meet you again tomorrow at 7:30. Okay, so and my screen share. Okay, so this screenshot will serve as your attendance for today. So I can see Farah, Prince, John Earl, John, Alika, Liana, Allen Tandok, Miss Martinez, and Jaire. Okay, so yeah, good morning to everyone. I will see you again tomorrow. Thank you for your attending this lecture for this morning. Okay, so good morning. Take care. God bless.
Thank you, sir. Good morning, sir.
Thank you, sir.